Good afternoon. I'm Tanya Tetlow, President of Loyola University, New Orleans.
And I'm Warner Thomas, President and CEO of Ochsner Health System.
Thank you everyone for joining us today. We're coming to you live from our digital communications hub here at Loyola. We have an exciting announcement and wanted to share our good news with as many people as possible, so welcome. First, a little housekeeping. Here with us today are members of Loyola and Ochsner's leadership teams. They're here to help share their expertise and answer questions, and we ask you to save those questions until we've all had a chance to speak. We'll hold a Q&A session following the announcement using the chat function. So let's get started. This year has proven in dramatic fashion that nurses are heroes, those that love science and people in equal measure. The profession of nursing embodies the Jesuit mission of Loyola. Nurses dedicate their lives to service. Every day they make critical ethical choices. They show respect for the inherent dignity of all people. They are medical experts in their own right, essential to the quality of care. And our country has a critical need for more nurses. Loyola University New Orleans and Ochsner Healthcare Systems are thrilled to announce that we have partnered to launch a new undergraduate nursing program. The Loyola Ochsner Nursing Program will provide Bachelor of Science in Nursing degrees to undergraduates as part of a full 4-year residential experience at Loyola, a Jesuit university that currently ranks 61st in the nation for the quality of our undergraduate teaching. Through this partnership, Ochsner Health System will provide both clinical faculty and clinical placements, allowing Loyola nursing students clinical practice in their world-class medical facilities and with the highest standards of medical practice. Loyola and Ochsner will build a new nursing simulation lab together in Loyola's high-tech and newly renovated Monroe Hall. And as leading service organizations in the Gulf South region and two of the city's largest employers, Loyola and Ochsner saw a growing need facing our region. We heard the call and we answered it together. By combining the power of Jesuit education with the excellence of the Ochsner Health System, we will educate students at the highest levels of healthcare, ethics, and passionate commitment. A majority of Loyola students come from all over the country, from 46 states, and so we will help import nurses into the state. Students eager to study in New Orleans, at a Jesuit university, and with the close clinical partnership of Ochsner. Warner?
I'd like to extend my thanks to President Tetlow and the Loyola community for your partnership and welcoming us to share this exciting news here today. You know, healthcare has been the subject of many conversations this year, and while it may take a pandemic to bring the topic of healthcare into every news program and dinner conversation, COVID-19 has highlighted the need and importance of having a trained workforce of healthcare professionals right here in Louisiana and across our region. Over the last several months, COVID-19 has challenged the entire healthcare system and our team at Ochsner Health in ways we had never experienced before. Having a strong and skilled workforce is one of the single biggest challenges facing Ochsner Health, and this issue is not unique to our organization. According to the Bureau of Labor Statistics, an average of 175,000 openings for registered nurses are projected each year over the decade, largely in part to retiring nurses. And this shortage is even more acute in the South. According to the Louisiana State Board of Nursing Center for Nursing, in 2019, 37% of licensed registered nurses living in Louisiana were 50 years old or older, and 17% of registered nurses were 60 years or older. With so many experienced nurses reaching retirement age, there is a clear and significant need for more nurses to enter the workforce. People who want to make a difference in the lives of others and help make our state and region healthier. That's why there's never been a more important time to invest in healthcare, education, and workforce development. At Ochsner, we're 100% committed to education and to strengthening education and workforce development programs here in Louisiana. In order to have qualified candidates to hire and take care of the people who need us, we need to make sure the appropriate education opportunities are available in the communities we serve. And as we continue to be impacted by COVID-19, which has infected over 175,000 Louisianians to date, our need has never been greater to train the next generation of nurses. These are significant challenges, so we've got to come together to think differently and to develop innovative solutions. We can't solely rely on tactics from the past to meet these needs and ensure we continue to provide high quality, nationally recognized care that our communities can expect. So as part of this partnership, and as the region's largest private employer and healthcare provider, we're proud to stand alongside Loyola University New Orleans to train, mentor, and eventually welcome a new generation of nursing professionals to the Ochsner team. Today is the next evolution in a long-standing relationship with Loyola. Over the years, Loyola students studying various disciplines ranging from translation and interpretation, healthcare systems administration and leadership, nurse practitioner to doctor of nursing practice have turned to Ochsner to complete a portion of their clinical training. With the launch of this new program, we are taking a significant step forward together by providing undergraduate Loyola nursing students the opportunity to receive not just some, but all of their clinical training under the umbrella of one health system. Thanks to this partnership, these students will have the opportunity to learn from the best and the brightest in the field here at Ochsner, the largest academic health system in the state and a nationally recognized leader. Students will also gain familiarity with the organizational structure and workings of an integrated delivery system, an added skill set that will aid the transition from student to working professional. This program will provide an optimal training ground for the next generation of nurses. Nurses we hope stay and work right here in Louisiana. Our way of life has undoubtedly changed this year, but this program provides students with an amazing career opportunity, our city with another amazing resource, and working together with Loyola, the opportunity to make a real and lasting impact in our community.
Students enrolling in this program will be firsts, but they won't be alone. Loyola has a long and exciting history in nursing education. This groundbreaking partnership is a powerful expansion of our existing academic offerings in the College of Nursing and Health. We started teaching nursing here in New Orleans more than 40 years ago. In 1991, we launched one of the first online nursing schools in the country, and some programs have been fully online since 2004. Today, we offer post-licensure online nursing degree programs ranked among the nation's top 50. These programs range from the BSN to the doctoral level and cover a variety of specialties, including nurse practitioner and healthcare administration and leadership. Now, we are bringing that tradition, skill, and reputation back to our lovely campus so our undergraduates can benefit from a full student experience and professional evidence-based practice within a 4-year undergraduate degree rooted in Jesuit tradition. We are truly educating students for the future of the work. A 2018 report by the World Economic Forum notes that global health and healthcare are some of the biggest areas of growth, and there will be a lot of cross-pollination of ideas from other disciplines. This collaboration between disciplines is easier at universities like Loyola, which have a history of working across disciplines. Given our history and expertise and this partnership with Ochsner, this program is particularly exciting. The BSN degree is the recommended entry to nursing practice, especially given the increasing complexities of patient healthcare needs and ever-expanding technologies. By making this a BSN program, Loyola is graduating nurses who are ready for lifelong learning and have the critical thinking and problem-solving skills to lead in healthcare. Another distinction of this program is that nursing students will benefit from Loyola's core curriculum, gaining a broad liberal arts education that widens perspectives to include sociological, economic, and political factors that impact the delivery of healthcare. Skills that students develop in this curriculum are exactly what the world is looking for. Because this partnership is so important to us, Loyola is also committed to supporting Ochsner nurses financially by providing scholarship so they can earn their MSN or DNP at Loyola. And we can help nursing students continue their education through our online and graduate programs. These programs are for career-minded nurses who want to expand their knowledge and skills, move up the management track, teach, or lead in hospital administration. Personally fulfilling to us is that this partnership is such a strong reflection of our identity. Jesuit education and rooted in cura personalis, or care and education of the whole person, mind, body, and spirit. This translates to a holistic view and approach towards healthcare. The program has been created entirely with the student experience in mind and a goal to produce highly skilled, well-rounded, and educated nurses in the Loyola Jesuit tradition who will serve as men and women for and with others. I want to note that we received Step 2 approval from the Louisiana State Nursing Board last week to launch this pre-license RN program. Enrollment now begins for fall 2021. The last leg of this approval will be when we receive the final approval from the Southern Association of Colleges and Schools Commission on Colleges, referred to as SACS-COC. That should happen later this year. Pending SACS-COC approval, Loyola anticipates graduating its first class in May 2025. This undergraduate nursing degree program at Loyola is something that our students and our community have said that they want and need. And we are extremely grateful to Ochsner Health Systems for joining us in this ambitious endeavor.
Hello, I'm Dr. Leo Sewani, and an alumni of Loyola, and I'm the Chief Academic Officer of Ochsner Health. Ochsner has a rich history of educating and fostering aspiring healthcare professionals that can be traced all the way back to our founding. We also recognize the importance of partnering with key pillars of our community to create innovative ways to foster the next generation of healthcare professionals. We're always seeking to not only provide but create opportunities for students to thrive in the healthcare field. Through our partnership with the University of Queensland in Australia, we're helping to train the next generation of doctors. And just last year, we teamed up with Xavier University here in New Orleans to launch a joint physician assistant program. A critical component of education is a commitment to research and the pursuit of innovation to find a better way to solve for the healthcare challenges of our community. Over the past months, our community has been hit hard by COVID-19, a pandemic which has impacted almost every aspect of our daily life. Thanks to our well-established reputation as a leading academic medical institution, we're playing a key role in the search for solutions to build immunity against COVID-19. Our team is working with researchers both here in Louisiana and around the world and is actively engaged in more than 30 COVID-19 clinical trials. We're united by a common goal: to identify a safe and effective vaccine for the benefit of all community members. None of this would be possible without the talented healthcare professionals working both on the front lines and behind the scenes to support and care for our community. It is important to recognize how the pursuit of research and innovation is closely intertwined with the highly qualified multidisciplinary team of healthcare professionals who are proud to work at Ochsner. And a key component of our multidisciplinary teams are nurses. We couldn't do it without them. By teaming up with Loyola to launch this new undergraduate nursing program, we're working together to educate the next generation of nurses. I'm proud to share that, on average, Ochsner offers more than 2,100 clinical placements to undergraduate nurses from a variety of nursing programs. A key part of our partnership with Loyola will be providing Loyola undergraduate students with all of their clinical placements. This eliminates any potential barriers to accessing hands-on clinical training these students need to be workforce ready when they graduate. Through this program, Loyola students will complete more than 730 hours of hands-on clinical training through 8 rotations at various Ochsner facilities. They will work and train alongside Ochsner healthcare professionals across a variety of specialties: adult and pediatric medical, surgical, women's health, behavioral health, and community health experiences. This diverse training opportunities within Ochsner's integrated healthcare system will provide these aspiring nurses with a solid foundation across core specialties, ensuring a smooth transition from student life into the work life. And it is our hope that after graduation, these students will choose to stay in Louisiana to work and serve our communities right here at home. We're so proud of the work behind the scenes to launch this program and look forward to working with Loyola on this exciting endeavor.
I'm Lorianne Ferguson, the Dean of the College of Nursing and Health at Loyola. Nursing education today combines classroom learning, simulation, and direct patient care experiences. In this program, nursing students at Loyola will study alongside their peers, pursuing the university's core liberal arts curriculum with a pre-nursing focus for 1 year, then move seamlessly to a nursing science focus full of experiential learning opportunities. Starting in their second year, nursing students will learn by doing through immersive simulation and direct care experiences that will allow them to develop critical thinking and interpersonal skills in a safe and controlled environment. Finding clinical placements and qualified clinical faculty can often be an enormous challenge for nursing programs. This academic partnership with Ochsner removes that barrier. Through the Loyola-Ochsner partnership, we are offering a creative solution that draws on the best of higher education and the best healthcare expertise in our region. Our students will receive classroom and clinical instruction from healthcare leaders at the top of their practice and their professions, allowing students to emerge as practice-ready nurses. Students will benefit from continued feedback and mentoring by Ochsner clinical faculty and leave the program already familiar with the organizational structure and workings of the healthcare system. This creates efficiency and opportunity, especially for those who wish to stay and work in Louisiana. A Loyola Jesuit education is an experience focused on developing the whole person. Students will see this in how we live our mission and vision through our teaching. The students will combine reflection and action, thinking about what is just and how to use their talents to improve the world.
Hi, I'm Tracy Moffitt, the System Chief Nursing Officer and Vice President of Quality for Ochsner Health. I have the privilege of leading over 6,000 Ochsner nurses across our hospitals, clinics, and ambulatory settings, and I'm proud to do so. 2020 has been one of the most challenging, but one of the most rewarding years for nursing professionals. When the World Health Assembly named 2020 the year of the nurse and midwife, they could not have envisioned the year we would have. For the 18th year in a row, the American people have responded to a Gallup poll by saying that nurses are the most highly respected profession in the country. I expect 2020 will be no different. Nurses play a vital role in the healthcare delivery system here at home and around the world, and 2020 has truly proven to be nursing's finest hour. If you ask any nurse or healthcare professional to reflect on the last year, you would hear incredible stories. I have seen people volunteer to be redeployed to the front lines in locations far from home because they simply can't sit on the sidelines. People who thankfully recovered from COVID-19 and couldn't wait to get back in the fight against the pandemic. Team members who sacrificed time with their families and experienced life-changing moments. As they did so, that they could continue caring for people during times of incredible need and uncertainty, and because no matter what, nurses step up to help and care for others. This is something that the world can use more of, especially when we continue to face the greatest health challenges of our lifetime. What was evident before COVID-19 and continues to be is the need to grow our workforce and train more nurses right here close to home. Each year, almost 1,500 qualified applicants to colleges of nursing across the state of Louisiana are turned away due to limited capacity. Ochsner Health is part of the solution. We are honored to partner with an incredible institution like Loyola University, New Orleans, to expand their nursing program. Providing the academic training and clinical experience will help to build a new generation of nursing professionals. Partnerships like this benefit our community, our organizations, and most importantly, our patients. As we approach the close of the Year of the Nurse, I'd like to thank everyone who has been called to care for others and encourage others to join this incredible and rewarding and profoundly important profession by considering this program. On behalf of over 6,000 nurses across Ochsner, thank you for your trust. We are proud to have cared for your families, and we are excited to grow our team in partnership with Loyola. Thank you.
That concludes the speaker portion of our event, and we'll take questions now in the chat function. They're typing it into the teleprompter for us. Just take a minute. Can current Loyola students transfer in? We will be building the program as we go, so we are evaluating how possible that is. Lorianne, do you have anything to add on that?
We certainly are going to build the program to allow students to transfer into the program.
Yes. So ultimately, it will be a choice that students can come to Loyola and decide after they arrive that they want to go into nursing. We're excited to persuade more and more of them to do so. Students can start applying right away. The website went live today, and they will be applying to enroll next fall, and we expect our first graduating class in 2025.
It'll be here before you know it.
Yes, I hope so.
I can take this one.
Yeah.
You know, how is New Orleans affected by nursing shortages? And certainly asked Tracy Moffitt to weigh in as well. I mean, certainly, you know, every day we see that there's a challenge with nursing shortages and being able to staff our facilities. I know today we have, you know, well over 300 agency nurses that travel from all over to come into Ochsner to help us care for patients. I don't know, Tracy, if you want to make a comment more specifically about, you know, how we're impacted here.
Yeah, I think that the nursing shortage, frankly, as Warner referenced in his earlier comments, is kind of a nationwide issue. And I think part of the solution is absolutely growing more programs, accepting more qualified students. The shortage itself is something that we deal with on a daily basis across our health system, and really working to make sure that we're partnering with other states where there may be an excess of nurses available, bringing them into the state of Louisiana. We certainly have the compact licensure now through the State Board of Nursing, and that makes that a lot easier to do so that we can fill some of those openings just in time.
So we have a question. Can you list some of the opportunities that will come as a result of this partnership? What's interesting about nursing education is that it used to be a more hospital model where hospitals trained their own nurses, and then it moved to an academic model where universities did it. And the big constraint on creating more nursing education to meet this huge demand from students and in the job market has been how the universities can place students in clinical settings and find faculty willing to teach the nurses on the job. So by partnering together of having the best of both worlds, we're able to get over that hurdle and make that possible.
Yeah, I think there's a lot of opportunities here that are really going to allow. I mean, once again, when you come into this program, you're going to know that you've got clinical rotations all set up. You're going to know the organization you're going to be working with. I know in some programs that's not necessarily the case. So the idea to be able to do your classroom training at Loyola, to be able to work at Ochsner for your clinical programs, I think it's just a really unique situation. As Tracy mentioned, and there's literally hundreds of potential nursing students that are turned away every year because there's not enough nursing program spots. So I think this is really a huge opportunity for the state, for the city, and for the region, and folks that want to get into nursing and can't because there's just not enough spots in the educational system.
Right. So how many students will start out in the program in fall 2021, and how many are expected to graduate in 2025? We are aiming ultimately for a class of about 90, and we will build up to that level as quickly as we can.
And I think we're going to see tremendous demand, quite frankly, for the program. I don't think applicants is going to be our real challenge here. I think it's about how do we do that in a controlled fashion and make sure we do it right. And I think that's why an organization like Loyola has done such a great job in educating folks, and Ochsner, in our clinical education. I think coming together, we're going to build a really unique program that is really going to train people well and set them up to have a great career.
Is there extra scholarship money available due to the partnership? Loyola and Ochsner have agreed to continue the practice of trying to meet financial need as much as we can for students and to make ourselves accessible through scholarships. So that will continue.
And once again, Ochsner has tuition reimbursement programs as well. So folks that are in our organization would be eligible for those tuition reimbursement programs. And we continue to work on various workforce development programs that will fund over time for people that are in Ochsner and want to continue to grow their career. And this would be a nice way to have someone be able to continue to advance their career if they wanted to, take a step and go this 4-year route. So, but regardless, people will have that tuition reimbursement available to them. So
that's great. What other programs are available for healthcare workforce development? Well, I know that Ochsner does incredible things internally, and Lorianne could talk about some of our other programs here in nursing and in business.
Well, Loyola already has an established graduate program. We have an RN to BSN program, so for registered nurses who want to receive their Bachelor's of Science in Nursing, we have a program that helps support them as they're working because it's delivered online. We also have a variety of graduate programs, master's level, that educate nurses to assume nurse administrator roles as well as family nurse practitioner. And we have our Doctor of Nursing Practice program, which further develops family nurse practitioner from a BSN to DNP, and 2 postmaster's tracks that allow development and receiving the Doctor of Nursing Practice degree.
Yeah, and I can just make a comment that, certainly Ochsner has a number of workforce development programs, not just for our own folks in our organization, but several of these that we have folks outside of Ochsner applying for. One's our Medical Assistant Now, or MA Now program. We're doing these programs in lab tech, surgical tech areas. So it really, there's a number of different disciplines, and especially in some areas that are more entry level. We are funding these programs, so they are tuition free for some of those entry level positions. And so you can certainly look at the Ochsner website and look for workforce development there if there's programs that you may be interested in.
And one thing I'll add, we just launched a Master's in Healthcare Law at our law school. So it's a 1-year degree where you don't need to get a JD, but you need to understand healthcare law to function in that very highly regulated world that you live in.
It is highly regulated. Maybe I should take that. Maybe I should take a year and kind of go,
Right. Is there a shortage of nursing educators as well? If so, how will you fill that gap? Can I turn that to Lorianne?
So that's one of the exciting things about this partnership, is that we can work together and collaborate with clinical faculty who may be employed at Ochsner with a vast experience and advanced degrees, but maintain the relationship in their employment at Ochsner while serving as clinical faculty for Loyola. So we look at this as a real win-win, where we get actual practicing nurses delivering the expertise that they are well versed in as they deliver and educate the future nurses.
And Tracy, you might want to make a comment, because I know there's a lot of our nurses, our veteran nurses, who want to teach and want to get into these types of programs to help share their knowledge. So
It's true, Warner. We're doing so much to make sure, particularly for the more seasoned nurse who may be interested in moving toward retirement, we are able to offer them, through a partnership with those organizations, an opportunity to teach in the academic settings and to bring nursing students into the clinical settings. Ochsner has some of the most elite nurses in the country, frankly, and we have a variety of clinical settings, and we believe those people are the best people to help bridge the gap for clinical faculty in the future.
I'd ask either of you to describe a nursing simulation lab, what that looks like.
So a nursing simulation lab is a really exciting place because with the advances in technology, we can provide more and more lifelike situations which mirror and mimic the real clinical setting. So students can learn to practice and have controlled experiences before they're actually in the direct care environment. Simulation mannequins can recreate a mother delivering a baby. It can recreate a patient having a cardiac arrest and all the things that need to be delivered for that patient, including medications and CPR, et cetera, as well as in a videoed environment so there can be feedback in terms of what went well and what didn't go so well. So students can learn to practice and have actually ensured quality of experience. So it's a really exciting thing to offer part of the education in a simulation lab.
We have a question. What can you tell us about the demand for undergraduate nursing degree programs in Louisiana? The State Board of Nursing says that there are 1,500 students who applied to nursing programs in the state who were turned away because there was not enough supply of nursing education. We also at Loyola recruit nationally, so we have an even broader group of potential nurses that we hope to import into the state. The critical shortage of nurses is not a function of students not wanting to become nurses. Right. It's been a shortage of nursing education.
Yeah. And I think that's what's so unique here is that, I mean, this is, without a doubt, fulfilling a demand that's there. Right. I mean, 1,500, qualified applicants a year. I mean, that would have a huge impact if we could get those folks trained and into the workforce. So this is certainly a big step in the right direction, and I think there's certainly more opportunity to do more education in the future, looking at those numbers.
Right. Why are the guaranteed clinical placements so important to nursing students? Who would like to take that?
I'm happy
Tracy?
to take that.
Yeah.
There are, despite the fact that there are so many nursing students, qualified nursing students waiting to access programs, there's also a dearth in some areas of really high quality clinical locations for students to train, which is one of the reasons that we're so excited about this partnership to be able to offer Ochsner and our multiple locations places in almost any specialty in any location for nurses in the program to train. And that's not always easy for other organizations to get their students placed in those clinical settings because there's just a limited number. So we're thrilled to be able to offer that to Loyola.
Well, that was our last question. Thank you everyone for joining us. As you can tell, we're very excited about this new venture and partnership. If you have questions at all, please reach out to the public relations staffs of either Loyola or Ochsner. And we're very happy that you joined us today. Thank you. Thank you, Warner.
Thank you.